At the end of March, Congress failed to pass a bill that would continue covering the cost of COVID testing and vaccinations for uninsured patients. Now, local healthcare providers face a tough choice. Now, your side's Claire Mollet is in studio now. You spoke with health officials who say they will continue COVID care coverage and absorb that cost.
That's right, Ken. The NCDHHS says people will still be able to access free tests from any testing sites sponsored from the department, as well as local health departments. Vaccinations will also continue to be free, but the loss of funding means the availability of those services may severely decrease.
That funding has been removed, which means people can get charged anywhere up to $200 just to get a test done.
StarMed Healthcare is one provider who will continue COVID-19 care at no cost to the uninsured. Their chief medical officer, Dr. Aaron Piramzadian, says the bill, which would have continued HRSA, the program which covers COVID-19 care costs for the uninsured, has not passed.
A lot of the Republicans wanted to take the funding from the states themselves. The Democrats didn't want the funding to come out of the states. They wanted the funding to come from somewhere else. So they're having a disagreement of where this money is coming from. Everybody knows that we need the funding. They're just trying to find where it should come from.
He says this is a huge concern because not all healthcare providers have the capability to absorb this cost, and COVID is not over.
And I expect a lot of places to stop treatments, especially. And that's going to be pretty bad because there is another wave coming. In the next couple of weeks, it's going to hit us pretty hard.
And the NCDHHS says they are continuing to advocate for the federal funding, saying in a statement, if Congress does not pass additional funding for COVID-19, the ability of the country to be prepared and continue to respond to COVID-19 will suffer. Federal funding is important so the federal government can enter into contracts with test and vaccine manufacturers to produce supply for the future. Piramzadian says all of this means fewer providers will have enough funds to provide testing and vaccines, meaning plummeting availability and much longer lines. Piramzadian adds he hopes Congress can come to an agreement quickly because it's unknown how long care providers will be able to absorb these costs. In studio, Claire Mollet, 9 on your side.